Well, thank you, Kerry and Jack, for meeting with Paul and me today. We've got a few questions for you as our distinguished guest presenters at the IPI upcoming weekend conference, which will be held on Zoom, February 4th to 6th, 2022. Now, your topic is going to be adolescence, an underappreciated developmental and treatment opportunity, but you certainly don't overlook adolescence. Why do you like working with adolescents?
Your question implies that some people don't like working with adolescents. We think that's true, and it may be a manifestation of what we call teenism, a prejudice against adolescents that is a general cultural attitude that has crept into our theories and affected our therapeutic practice.
Jack and Kerry, I have a question. Your therapeutic interventions seem very clear and simply stated. Could you comment on that?
Our teacher was Anna Freud, and she had a genius for saying complex things in straightforward ways. We try to emulate her, since there's no good reason to make things obscure. Fancy jargon can too easily hide muddled thought.
Thank you.
Those therapists who do see adolescents worry very much about concerning their privacy, and therefore they do not see the parents. But I believe you disagree with that. Now, why do you disagree?
Differentiating between privacy and secrecy is central to our approach to working with the parents of both child and adolescent patients. We're committed to protecting the privacy of thoughts and feelings while not colluding with the motivated withholding of secrecy. This stance leads to setting up dual goals of treatment, restoring the adolescent to the path of progressive development and restoring the parent-child relationship to a lifelong resource for both, which then includes better sharing and communication.
Makes sense.
Yeah. So you'll be talking about treating a young man with sadomasochistic constellation, or displaying sadomasochistic constellation. Could you say more about that? What is that?
Well, every power relationship, including the power relationship of the therapist and the patient, lends itself to sadomasochism. Sadomasochism is the active pursuit of physical or mental pain in the service of attachment, defense, and gratification. For the past 60 years, we have studied the sadomasochistic closed system response to trauma as it develops through the life cycle. Adolescence is a crucial stage for setting aside closed sadomasochistic modes of functioning in favor of realistic, open system self-regulation, establishing the pattern for creative and loving adult functioning.
Well, obviously you've spent a lot of time working in the private practice office with individual children and adolescents in psychoanalysis, but you've also worked in the community. Can you tell us a bit more about that work?
We think psychoanalytic ideas have broad application beyond clinical practice and that other fields have much to offer us. Throughout our careers, we've enjoyed and benefited from our work with teachers, nurses, pediatricians, business people, community organizers, and more in many different settings. We look forward to sharing some of the mutual learning from those activities.
Oh, great.
Yeah. Well, Kerry and Jack, I want to thank you for taking the time today to help us promote this February weekend, and also for giving the viewers, hopefully who are watching us, some idea of the topics that you're going to be addressing over the weekend. So I want to thank you very much.
Thank you, and we really look forward to working with everyone.
Thank you.
Thank you.
Great. All right.
Bye now.
Bye now.
Bye.